Okay. All right, we're gonna go through the process of priming and hanging primary tubing on a continuous line. First thing you want to do is check the physician's order, make sure we have an order to hang fluids for our patient, and then we want to make sure we gather our equipment. So that first check to make sure the order will be our first check of our 3 that we need to do when administering medication to our patient. Then we want to gather our equipment. So we want to make sure we have our IV pump with a channel. We have our primary IV medication. In this case, we have a bag of 250 ml normal saline. We're going to need a package of primary tubing. This is for the Alaris pump infusion set. We're going to want an IV tubing label and an alcohol swab. So after checking our order, we've gathered our equipment, we enter the patient's room. Again, we want to identify our patient, perform our 3 checks, complete our 6 rites of medication administration, perform hand hygiene, don clean gloves, and then we'll move on to our primary IV fluids. So this is how they will be packaged. Most of the time when we're giving maintenance continuous fluids, they're going to be in 1,000 ml bags. This is just a smaller version. So we want to remove the IV solution from its packaging. In doing so, we want to inspect our medication bag. And what we're looking for is to make sure that the bag is intact. There's no leaks noted, no leaking of the fluid. And then we want to check the expiration date. This one expires in May of 2020. And then we will also inspect the solution in the IV bag, checking for any cloudiness, discoloration, anything like that. So once we are okay with our IV solution, we can go ahead and hang it on the IV pole. And we can prepare our primary tubing. So we have our primary tubing bag. First thing we want to check is to make sure that's intact, no tears in the tubing, so we know that the tubing is sterile within the package. We also want to check for the expiration date, which will be on the package. Here we are good May 14th of 2021. So our tubing is okay. Has a tear to open up top, just remove that, and we can remove our primary tubing. First thing you want to do when removing primary tubing, you'll notice that the roller clamp is open. Reason for that is if our roller clamp was closed, we would, for an extended period of time, we would cause damage to the tubing. So they're always pre-packaged with the roller clamp open. So the first thing we want to do to prevent losing any fluids is to make sure we close our roller clamp. On the tubing here, you'll notice you have some tape. I like to remove it right away, totally up to you, and when you get comfortable priming tubing, I just like to get rid of it here. And then you'll notice you have your spike, which has a sterile cap on it. You have your drip chamber, and you have your tubing. Along the tubing you have a few what are called medication ports, and it'll be important to note the direction of those when we start to prime our tubing. So you want to make sure you have good control of your tubing. You don't want it kind of dangling around. We want to keep this as sterile as possible, not contaminating either the spike tube or the end of the tubing where we have a protective cap. So we have our roller clamp clamped. I'm going to hold this in my non-dominant hand. It'll come over to your primary IV bag. You'll notice on your IV bag you have 2 separate ports. This one on the left here is a medication port. This is where Frmc can inject any additives that may be necessary. We as nurses will not inject any medications into primary IV bags. That's something that Frmc will always do. Your other one is going to be your spike port, and it is covered by this blue cap. So what you'll do, remove the blue cap there, trying to keep it as sterile as possible. I have my IV tubing, remove the protective cap, not contaminating the IV spike. And note this is kind of sharp, so be careful when spiking your primary fluids. You have the possibility of spiking through here or maybe through the bag, which will cause a leak. and we'll have to replace the IV bag. So to spike the primary bag, we're going to stabilize here, again trying to keep that sterile. We're going to inject the spike there, and it takes a little bit of force. You just have to do a little bit of twisting. You'll notice that I've kind of broken the seal in the IV bag there. When I do that, you'll notice there's no medication filling in the chamber. That's because I have my roller clamp on. We can discard the spike cap into the trash can. So we want to pre-fill the drip chamber prior to priming our tubing. To do that, we want to make sure our roller clamp is clamped, and we will squeeze the drip chamber a few times. Our goal here is to fill the drip chamber no more than 1/2 to 2/3 full. We do not want to fill this entire drip chamber. If we do that, we won't be able to notice any of the fluids dripping to be able to count our drips if we need to. So we want to squeeze one more time, and we have it about 1/2 to 2/3 full. At this point, we'll then go to our primary tubing. You can leave that blue piece on if you wish. And we want to make sure that these medication ports are inverted when we're priming our tubing. And the reason we do that is because there is air filled in the medication ports. By inverting them, we're going to remove that air as we prime the tubing, because we do not want to inject our patients with any air into their veins. So what I'll do, I will invert my tubing. I'm going to remove my protective cap, again trying to keep this as sterile as possible. We do not want any contamination. I got it a little bit. There we go. Untangle that. Make sure my ports are inverted. And I'm going to hold on to my roller clamp. You want to make sure you prime your tubing slowly. We do not want to rapidly prime the tubing. That can cause increased air bubbles and it'll take longer to prime, and we want to lose as minimal fluid as possible. So what I'm going to do is slowly release my roller clamp. As I do that, you'll notice the tube or the fluid infusing through the primary line. Once the fluid has gotten past the medication ports, you can revert if you desire. I'm just going to keep them like this until the medication's all the way through. So again, nice and slow, making sure there's no air bubbles throughout the tubing. If so, we just make sure we prime until those are all gone. I hold it over the trash can here, again making sure I keep this clean just until the air bubbles are removed. Once that occurs, I re-clamp my roller clamp, making sure everything's clamped, and I will go over to my patient. I'm going to verify placement of the IV by checking for blood return, performing a saline flush. You always want to perform a saline flush before administering any medications to confirm patency of the IV catheter. So we'll just imagine here that I have inspected my IV site, I've performed a saline flush, I've checked for blood return, I performed 15-second alcohol swab onto my injection port here, and I can connect it to the patient. Again, takes a little bit of force and twist, and we are connected there. Now we want to connect it to our IV pump. To do so, we're going to want to remove this blue protective cap like so. We'll open up our channel here, and then you'll notice this section will slide right in and it'll click. And then you don't want to jam this part into the channel. You just kind of want to set it in there like so and make sure that the door closes without any problem. So we've now primed our primary tubing for our continuous infusion, and now we'll go ahead and program our IV pump. So again, we turn the system on. While that's powering up, we always want to make sure we label our tubing appropriately. We want to make sure at all times our tubing is labeled so that the oncoming nurse will know when it needs to be changed. For a primary continuous line that is going to be staying connected to our patient, the tubing is good for 96 hours. And we want to label that with the day or date that the medication is, or that the tubing needs to be changed. So we're going to say no, it's the same patient, confirm that it is our med surge. From there, we will hit channel select. We will select guardrail IV fluids. We're going to select maintenance fluids. We just have normal saline going. Confirm. And we want to go at our prescribed rate. We're going to say that this medication was ordered at 125 milliliters per hour. So we will select rate, type in 125, it'll tell me milliliters per hour. Then we'll go down to volume infused. This bag in particular has 250 mLs. Most primary continuous infusions are going to have 1,000. So we'll type in 250. And then we have some options here. We can hit delay, volume duration, secondary, or start. We've confirmed everything is good with our IV site here. We're going to go ahead and hit start. And you'll notice up on the channel here, orange light where it says standby, and a message that goes across the screen. It's telling us it's maintenance IV fluid. It's checking the line to make sure that it is open and patent. If it is not, you will get an alarm like this. Left-hand side will alarm red, and your IV channel will tell you something. Here it is saying occluded patient side. So that tells me something on the patient side of the pump, which will be below the channel, is occluded, preventing the fluids to go through. So I always want to remember, before I can infuse any medications, I need to unroll my roller clamp so that it is open. I can go ahead and hit restart, and you'll notice I have a green light saying that it is infusing. It'll tell me maintenance IV fluids infusing at 125 milliliters per hour. Also, before you leave the room, you want to make sure you label the bag. Our fluid bags are good for 24 hours, whether we infuse the entire bag or not. So we want to make sure we label the bag before we're leaving the room with the initials of the nurse hanging the bag, the date and time that the bag was hung. Before leaving the room, we also want to make sure that our drip chamber is dripping, so we know that it's infusing. And we want to monitor that IV site initially to monitor for any signs of infiltration, any leaking or discomfort that the patient may feel.